Let me bring on our head-to-head combatants here. The spokesperson for Planned Parenthood is Rochelle TaFolla. Rochelle, welcome to Houston's Morning News. And Christine Melchor, Houston Coalition for Life, Executive Director. Ladies, it is great to have both of you with me here this morning. Rochelle, I want to start with you. I don't know if you just heard what I said, but it appears that the Department of Health and Human Services has now kind of put into Obamacare a $1 premium pay for folks that are going to go to these exchanges that will go to provide abortion. Do you know anything about that?
No, that's news to me, and it actually doesn't make any sense since there's a federal ban on any federal tax dollars going to provide abortion care.
No, you're talking about the Hyde Amendment, I assume.
Right, that's been in place for many years now, and that's one of the false information that has been submitted to the public that
but
at any point there's taxpayer money going for
this would change the Hyde Amendment.
I don't think that that's possible without legislative input.
Let me go to Christine right now. I don't know if you heard anything about this. I'm reading this out of Life News.
No, Matt, I have not heard anything about that. However, we do know that Medicaid dollars are not supposed to go to any facility that provides abortions.
All right, we'll drill down deeper this. I would suggest that if you guys get an opportunity, and again, I am just coming across this now. Somebody sent this to me, so I'm just reading what I have here. Life News is where I'm getting this, and it is apparently official from the Department of Health and Human Services. Let's talk about yesterday, what took place yesterday. Rochelle, you say it's not about abortion, but really, I don't think in the state of Texas we would have a problem with the $35 million that the governor is taking out of the women's health program going to Planned Parenthood if you didn't provide abortions. If you would take that off the table, and you and I have talked about this before, I wouldn't have a problem with Planned Parenthood.
Well, that is a personal opinion. Frankly, what we provide is a full range of reproductive health care. And what this program is about helping women get basic health care. That is their annual exams, cervical cancer screenings, breast exams, and Governor Perry is trying to distort the issue by bringing abortion into the discussion, and that is completely wrong. He cannot be trusted on women's health care.
Christine?
Well, we don't consider abortion women's health care, and we know that in the special session in Texas this past June, Senate Bill 7 was passed that explicitly excludes contractors that provide abortions or are affiliated with abortion providers from being part of the women's health program. I have a list in front of me of 32 other facilities just in the Houston metropolitan area that will provide well women exams and mammograms, which Planned Parenthood does not provide. All they do is simply a manual exam. So there is not a shortage of healthcare providers that can supply these services for women.
It's interesting that Christine points that out, that she likes to point out that there are other providers. There may be other providers, however, they are not serving the women that need these services, and that's the point. Women are coming to Planned Parenthood because they trust us and they know that they can get reliable, confidential health care from us.
Why would they go to an abortion clinic to get health care services when they can go somewhere else, Rochelle?
Well, because abortion is only one portion of the services we provide. It's less than 10% of the services we provide. They come to us for family planning, cervical cancer screenings, and they know that they can get in to see us. They know they'll have a friendly face inside, and they know they'll be treated with respect.
Ladies, I want you to hang on. When we come back, Christine, I want you to respond to that 10%, if you could, that number that they keep throwing out there, that only 10% of what they do is abortions, when about 80% of their funding comes from clinics. Christine, I want to give you an opportunity to respond to Rochelle. She said last segment that only 10% of what Planned Parenthood does are abortions. Is that correct in your estimation?
No, Matt, it's not correct, because we know that they break down these individual visits into 4, 5, 6 visits to make it look like that there are many other services are for things other than abortion. Just this past Friday, a federal whistleblower lawsuit was filed against Planned Parenthood of the Gulf Coast, stating exactly this, that Planned Parenthood leaders register all kinds of ineligible services related to the abortion and bill Medicaid for them. So
That's
in reality, the
false.
one abortion service looks like 6 other services in one abortion. So that's how Planned Parenthood gets around accurately reporting the percentage of services that are related.
Rochelle, I want to give you a chance to respond. Go right ahead.
Thank you. It's completely false what Ms. Melchor is saying. We know what services we're providing. In fact, our services are separated by state law into two separate corporations. We have a corporation that provides abortion services and one that provides family planning services. We provided over 110,000 medical visits in family planning alone last year.
Where does most of your funding come from, though, Rochelle?
Our funding comes from government contracts for services that provide family planning care, and there's also a portion from the clients that pay for it.
Is that a nice way of saying abortion clinics?
Absolutely not. I just told you at the beginning of the hour that there is no state or federal program funding for abortion care. I'm talking about family planning care, women coming in for their annual exams, for cervical cancer screenings, breast exams, and birth control.
Let me ask you this. If the governor finds the $35 million to replace the money that he is not taking from the federal government, and women can go to other places in order to get their care, would you be okay with that? As long as the women are being taken care of, would you be okay with that?
Our mission is for women to have access to affordable health care. If they can have consistent level of care and access to that care, which we know will be a huge challenge because Planned Parenthood sees almost half of those women. If they could do that, we would be happy. Like I said, Governor Perry's record on women's health is not good, and he really can't be trusted on this issue.
Ladies, I wish I had more time, and I just want to say to both of you, thank you for taking the time. I realize that this is an issue that we're not going to solve here in our two segments, but I thank you for coming on and having this discussion.